Bismillahirrahmanirrahim. Our lecture today about the anatomy of the vertebral column together with the joints and ligaments. At the beginning, we will talk about the concept of the vertebral column regarding its segmentation. The vertebral column, also called the spine, spinal column, or backbone, composed of series of bones called vertebrae, located in the midline, posteriorly extending from the craniocervical junction and terminate at the coccyx. It consists of 33 vertebrae divided on 5 segments. The first segment is the cervical segment, which consists of 7 cervical vertebrae, and thoracic segment, which consists of 12 thoracic vertebrae, and 5 lumbar segment, which consists of 5 lumbar vertebrae. These first 3 segments regard as movable segments. In addition to that, we have the sacral segment, which consists of 5 fused vertebrae, and coccygeal segment, which consists of 4 fused vertebrae. In this segment, there is a variation in the number of vertebrae, which may be 3 or 5 vertebrae. The last 2 segments regard as unmovable segments. Now, the function of the vertebral column. The basic function of the vertebral column is to protect the spinal cord and the spinal nerves. In addition to that, supporting head and shoulder girdle, rib cage, and attach. The concept of the vertebral column regarding its curvatures. In the fetus, there is a single concave curve. There is a single concave curve at 3 months after birth. When infant lifts head, the cervical curve develops, and when child sit up, stand, and walk, the lumbar curve develop. So we have a primary curvature, which are the thoracic and sacral curve, and secondary curvature, which are the cervical and lumbar curvature. Now, the function of the normal curvature of the vertebral column. It's increase its strength and help maintain balance in upright position, and absorb shocks during walking, and help protect the vertebra from fracture. Now we will talk shortly about abnormal spinal curvatures. This image shows at the left side the normal spinal curve. Next, we have kyphosis, which means increase in the thoracic curve of the vertebral column, and lordosis, which means increase in the lumbar or cervical curve of the thoracic of the vertebral column, and scoliosis, which means bending of the vertebral column either to the right or left sides. صراحة السكوليوسيس احنا نشوفها هواية بالمعهد، فحبيت يعني احكي عليها في اشياء بسيطة. As we mentioned, scoliosis means lateral bending of the vertebral column as measured by cube angle, which means the angle between 2 lines that are drawn along the end bend of the most tilted vertebrae toward each other. And the angle between these lines is the cube angle, which measure either directly or geometrically. And if cube angle between 10 and 20 degree, it's mean mild scoliosis. If it's between 25 to 45 degree, means moderate scoliosis. And if more than 45 degree, it means severe scoliosis. Now we will talk about typical vertebrae. Typical vertebrae generally consist of vertebral body, the large anterior cylindrical portion that is predominantly responsible for bearing the weight of the spine and body above it. The size of the vertebral bodies increases down the spine as the size and weight of the body it has to support above it increase. Its superior and inferior surface are roughened, give attachment to the intervertebral disc. While vertebral arch is comprised of the bone posterior to the vertebral bodies, which has several individual components that are fused to form a ring, which is the vertebral foramen that includes the spinal cord. The vertebral arch component are pedicles, laminae, and seven processes. The pedicles, which are short, thick bilateral processes that protrude posteriorly from the posterolateral corner of the vertebral body, forming the lateral walls of the vertebral foramen. The superior and inferior margin of each pedicle are slightly curved and form of vertebral body and vertebral arch. And vertebral arch consists of pedicles, laminae, and seven processes. We talk about posteriorly from the posterolateral corner of the vertebral body, forming the lateral wall of the vertebral foramen, and the superior and inferior margin of each pedicle are slightly curved and form the vertebral notches, which, when an adjacent vertebra is joined, equate the intervertebral or neural foramina, which transmit the nerve roots and associated vessels. The lamina are bilateral flattened plates that extend posterior-medially from the posterior margin of the pedicles to meet in the midline, forming the posterior wall of the vertebral foramen. Now we have the processes of the vertebral arch. Seven processes arise from the neural arch that provide articular support and attachment for ligaments and muscles. Bilateral transverse processes project posterolaterally from where the pedicles and lamina fuse, and a single spinous process projects posteriorly from the lamina in the midline, and bilateral superior articular processes are lined with synovial cartilage and project superiorly from where the pedicles and lamina fuse. They contribute to the facet joint above. And bilateral inferior articular processes are lined with synovial cartilage and project posterior-inferiorly from where the pedicle and lamina fuse. They contribute to the facet joint below. And the distance between the superior articular process and inferior articular process are called pars interarticularis. This image shows the typical vertebral body, typical vertebra, which consists of vertebral body anteriorly and vertebral arch posteriorly. And here we can see the pedicles, bilateral pedicles and bilateral lamina, bilateral transverse processes and spinous process, and superior and inferior articular processes, and the superior and inferior margin of the pedicle that when joined with other vertebra form the intervertebral. Here we have axial CT scan of the vertebral column. We can detect the vertebral body, pedicle, transverse process, lamina, and the spinous process. And here we have AP and lateral X-ray showing the pedicle, intervertebral disc space, spinous process, and transverse process. In addition to that, we have clavicle and ribs. While in lateral view, we have thoracic vertebral bodies, neuroforamen, and intervertebral disc space, superior vertebral end plate and inferior vertebral end plate and superior vertebral end plates, and pedicle. In addition to that, we can see the ribs. Now we will talk about atypical cervical vertebrae, typical cervical vertebrae, which include C3 to C6 vertebrae. The most distinctive feature is the presence of the foramen transversarum in the transverse process. This transmits the vertebral artery except C7 and its accompanying veins and sympathetic nerve. Transverse processes have anterior and posterior tubercles, and small lips are seen on the posterolateral side of the superior surface of the C3 to C7 vertebral bodies. The uncinate processes with corresponding level on the inferior surface, small joints called neurocentral joints of Luschka or ancovertebral joints are formed between adjacent cervical vertebral bodies. At this site, these are not true synovial joints, although often called so. The cervical vertebral canal is triangular in cross section. The spinous processes are small and bifid, whereas the articular facets are relatively horizontal. Here we have 3D CT scan of cervical vertebra. We can see the vertebral bodies and the transverse process with its anterior and posterior tubercle and foramen transversarum. In addition to that, we have superior articular facet and lamina and bifid spinous process. Here we have anterolateral 3D CT scan of cervical vertebra. Also, we can see the vertebral bodies and the transverse process together with anterior and posterior tubercle, lamina, and bifid spinous process. Now we will talk about atypical cervical vertebrae. At the first, we have the atlas, the first cervical vertebra. The atlas has no body as it is fused with that of the axis to become the odontoid process. A lateral mass on each side has a superior articular facet for articulation with the occipital condyles in the atlanto-occipital joints, also an inferior articular facet for articulation with the axis in the atlanto-axial joints. The anterior arch of the atlas has a tubercle on its anterior surface and a facet posteriorly for articulation with the odontoid process. The posterior arch is grooved behind the lateral mass by the vertebral artery as it ascends into the foramen magnum. This image, we have superior and inferior view of C1. We can detect the anterior arch and posterior arch. In the anterior arch, we have anterior tubercle and facet for articulation with the dens. We have lateral mass, which consists of superior articular facet, transverse process with a transverse foramen, laminae, and posterior tubercle. Also, we have 3D CT scan of C1. We can see the anterior vertebral arch and posterior vertebral arch. In the anterior arch, we can detect the anterior tubercle, lateral mass, which consists of transverse process and foramen transversarum, superior articular facet. And here we can see the groove for vertebral artery and posterior tubercle. The next, we have the second cervical vertebra, which is called the axis. The odontoid process, which represents the body of the atlas, bears no weight like the atlas. The axis has a large lateral mass on each side that transmits the weight of the skull to the vertebral body of the remainder of the spinal cord. Sloping articular facets on each side of the dens are for articulation in the atlanto-axial joint. Two lamina which fuse to form a large, commonly bifid spinous process. In this image, we have anterior and posterior view of the axis. We can see the dense and articular facet for anterior arch of atlas, pedicle, superior and inferior articular process with superior articular facet for atlas and inferior articular facet for C3. Between them, we have pars interarticularis. And also we can see transverse process and foramen transversarum. Posteriorly, we can see lamina and bifid spinous process. Here we have open mouth view or odontoid view of skull X-ray. We can see the odontoid process and the transverse process of C1. inferior articular facet of C1 and superior articular facet of C2, lateral mass of C1, body of C2, and transverse process of C2, and also we have a posterior arch of the C1. The last cervical vertebra is the vertebral prominence C7. This name is derived from its long, easily felt, non-bifid spine. Its foramen transversum is small or absent, and usually it transmits only vertebral veins. The anterior tubercle of the transverse process is smaller than other cervical vertebrae. This C7, we can see the body transverse process with the lamina and spinous process, superior articular surface. The transverse foramen either small or absent. Now we will talk about joint of cervical region. From above, we have the atlanto-occipital joint. Between occipital condyle on each side of foramen magnum and superior articular surface of atlas is synovial joint. These joints act as a single joint and allow flexion and extension, nodding of the head, and some lateral motion. Also, we have three joints make up the atlantoaxial joints, a small synovial joint between the anterior surface of the dens and the posterior aspect of the anterior arch of atlas. And also we have synovial joint between each lateral mass of the atlas of the axis. This joint called median atlantoaxial joint, and this joint called lateral atlantoaxial joints. The main function of this joint is the axial rotation in addition to minimum flexion and extension and less lateral flexion. And we have small joints called neurocentral joint of Luschka or ancovertebral joints are formed between adjacent cervical vertebral bodies of these sides. These are not true synovial joint, although often called so, as mentioned previously. Here we have ancovertebral joints and the superior surface of the vertebral body. The joints between the vertebral bodies of the intervertebral discs are secondary cartilaginous joints. Facet joints occur between the articular process of the neural arch of the vertebrae. These are synovial joints. Here we have axial CT scan. We can detect the cervical intervertebral disc, left uncinate process, superior and inferior articular process between them, the facet joints, bifid spinous process. On the sagittal CT scan, we can see the superior, inferior and superior articular process and facet joint between them, in addition to the pedicles and neural foramen. In addition to that, we have the coronal CT scan. Also, we can say bilateral occipital and we have left lateral mass of C2. In sagittal CT scan, we can see occipital condyle and lateral mass of C1, between them occipito-atlantal joints and atlanto
راح الصوت. بس عندي